Okay, so today for our third educational session, we decided to discuss more about peer support. So we named this one "Let's Talk More About Peer Support." It was greatly requested previously to kind of provide more resources and more information on peers and peer support, and really more things and information about peers in general. And just like always, we'll just begin with introductions and then a little more information about AOT and discussion on peer services, and then we will have a more expanded discussion on services NAMI provides for peers. So if everyone could go ahead and put in the chat box your name and the county that you are in and your role with AOT, and as well as if the AOT specialist, if you could put in your email address just in case anyone has any questions later on, they could use your email address as a reference. So the first topic for today is just expanding a little bit more on assisted outpatient treatment. So that was one of the questions that we received previously during our second session, was to be able to provide more information on AOT. And so with that one, with what AOT is, and so what is assisted outpatient treatment? So AOT is a tool that civil courts and mental health systems employ collaboratively to help individuals with serious mental illness, or SMI, reverse the cycle of repeat hospitalization and incarceration. AOT is an alternative to inpatient commitment or incarceration for people with severe mental illness. Through a court order and enhanced monitoring, AOT aims to engage in treatment and ensure that the mental health system is attentive to the needs of its most vulnerable clients. So with an AOT, participants must adhere to a treatment plan that has been developed by their treatment provider, and that may include appointments and a medication plan. And with AOT, that also includes a court order. The court order also requires that the individual and their treatment team give the court regular updates on the individual's treatment and adherence to the treatment. So how does that work? With AOT provides evidence-based care for individuals with serious mental illness via comprehensive systems and teams to address individual needs. The program focuses on an approach which provides treatment rather than incarceration to individuals with serious mental illness, and engages various sectors of the mental health, criminal justice, and safety system. So a question that we receive very often is if a court order is essential when it comes to the AOT process. And research shows that attaching that court order to AOT has, and it monitoring to mental health services improves outcomes for individuals with histories of treatment disengagement. And the court order also exerts influence on providers to maintain service quality and remain mindful of the participants' engagement level by imparting a sense of mutual responsibility and accountability to the judge. So with how the court orders are enforced, which is also a frequently asked question, it is not unusual for an AOT participant to miss one or more scheduled appointments, or even to stop taking prescribed medication in violation of their AOT order. This alone would not be legal grounds to revoke outpatient status and seek to commit the participant to a hospital, nor should it be grounds to hold a participant in contempt of court or to forcibly administer medication. So with non-adherence to the court order should trigger a reevaluation of the participant's clinical needs. Timely response to non-adherence is an important mechanism for AOT to be effective. And there are times that when it comes to different conversations with AOT and different myths around AOT, such as AOT has no traction, or AOT forces participants to do something that they against their will. So with these court orders, it's really just helping keep maintain that cycle of a participant knows that they should be going to their appointments, they should be taking their medication. But if this doesn't happen, then it's the treatment team coming together and reevaluating the needs of the participant to see what would better fit and determine the reason why this non-adherence may be happening. And with that, the length of the, if another question is, does the length of the court order matter? And sometimes what we see is there's different suggested lengths of AOT. What TAC recommends is typically 6 months or more. And gains achieved under an AOT court order are more likely to be sustained after AOT and intensive services end if the participant remains in AOT for at least 6 months. So within these 6 months, it's easier for the treatment team to determine what services might be necessary or the improvements the individual has accomplished. A program decision to allow an AOT order to lapse should not be based solely on the participant's success in avoiding hospitalization and arrest during the AOT period. So what that means is to sometimes when a participant is doing well, they're going to their appointments, nothing detrimental has happened, they seem to be improving. Sometimes it's easy to make the decision to maybe they don't need to be on the AOT order anymore, and that sometimes that's why we should follow the 6 months recommended period just to see if those improvements will continue on. That's why a clinical evaluation should consider whether the participant has come to recognize the importance of treatment adherence in maintaining those improvements. So that's really what we look for while a person is under an AOT order. In some cases, non-renewal will be appropriate upon a clinical determination that despite best efforts, the person is not likely to benefit from continued AOT, which is something that we see sometimes as well. It's the person was put on AOT order, they have been on AOT for an X amount of times, and we're not seeing any improvement, and that would be that jurisdiction to then determine if AOT should not be continued is up to their treatment team and the judge to kind of make that decision together. What are the potential benefits to AOT? So AOT can dramatically reduce hospitalization, criminal justice involvement, treatment disengagement, and a range of harmful behaviors for its target population. So what research shows is that AOT does substantially help with that revolving door of less incarceration and less hospitalization for individuals that are under that AOT order. AOT also helps reduce the associated resource strain and fiscal burden on public mental health systems. And is AOT effective? Studies show that AOT can drastically improve treatment outcomes and substantially reduce the likelihood of repeat hospitalization and criminal justice involvement. And according to the Treatment Advocacy Center, so these statistics are taken from the research TAC has done nationwide with different AOT programs, and they have seen that hospitalizations have gone down by 77% nationwide if they are actively using an AOT program with participants. Also, the length of hospital stays have gone down by 43%. Any arrests have also gone down by 83%, and they have seen that individuals that have gone through AOT programs or are on that AOT order, their satisfaction to AOT is about at 92%. And they have seen this in the different states that that they have AOT and they're that researching there. They recently in Ohio they published this in January, but the individuals that are involved in AOT in the state of Ohio, they have seen great numbers with satisfaction with the AOT, their AOT services, and have seen that drastic decrease in things such as hospitalization and incarceration, which is what we like to see when it comes to an AOT program. And the following along, our next discussion will be about all things peer, an open discussion between Gina, who is the AOT specialist in Ellis County, and Chris, who is the AOT specialist in Douglas County.
So hi Gina, how are you? Am I?
There we go. Okay.
Hey Gina, how are you?
All right.
All
How
right.
are you doing?
I'm okay. I'm okay. I just thought that we should open with maybe so our discussion is going to be about peer support. Sorry, about essentially peer support. I thought I'd open with maybe a definition of what recovery is, because recovery is a huge part of how peer support operates. There's two definitions. One is from SAMHSA, 2013. SAMHSA defines recovery as a process of change through which an individual improves their health and wellness, lives a self-directed life, and strives to reach their full potential. Before I move on to the next definition, which is from the Appalachian Consulting Group, but what are your feelings on in terms of the process of change that people go through to become to recover how does, I guess, to phrase it better, how does peer support help people recover?
Yeah, I think for the people that I work with, recovery is based on their willingness to um receive education and to understand maybe their triggers, because I think that a lot of times we say recovery, but we don't know what that means. And so I'm going to break it down a little bit more. Recovery means that you have a self understanding of your own diagnosis, and you have an idea of what triggers you, and that maybe in your treatment plan or even your own self plan, you have a way to deal with those triggers when they come up.
So it's about self-understanding.
Yes.
Yeah. And you know, before I jump into that, which is really quite an important and well said remark, I thought I'd throw the other definition, which is a little different. This is from the Appalachian Consulting Group. It goes the following way: the process of gaining control over one's life. This is recovery, and the direction one wants that life to go on the other side of a psychiatric diagnosis, and all of those losses usually associated with a psychiatric diagnosis. So yeah, almost very much like what you're trying to suggest is that um, there's a way of getting a hold of your life that takes place in the process of recovery, um, that involves a lot of, I guess, personal. Um, it's a process of kind of a self-education, understanding what do you need from the system, what do you need from other people in general, and certainly when you do arrive at that information, being able to kind of direct your own ship and be able to kind of self-determine, as they say, um, uh, the course to the things that you need in the community, in your life. So, um,
Yeah, I think it's really important. I like the first part where, because when you first get your diagnosis, a lot of people are in shock. They are in denial sometimes, And so there's a process of time period that goes where they learn to accept their disease, whatever it is, whatever their diagnosis is. Just you know, very much in the same way if you get a diabetes diagnosis or something like that, you have to learn about it and you have to come to accept it with as part of your life and how that's going to change. Well, the same thing happens when you have a mental health diagnosis. You know, there's that time that you've got to come to terms with it within yourself. And as you start the recovery process, you become more able to talk about it, and the more you can talk about it and share, the more other people share back. So it relieves the stigma if you are with a group of people that work with that and understand that sharing is a part of caring for each other.
Absolutely. So absolutely. So peer support becomes a wonderful process where we engage with others in a meaningful way through a process of active listening, of empathy, um, taking the place of taking the putting oneself in the shoes of another person, uh, so that it's really a growth experience for both people involved. And it's interesting in that respect. You can kind of walk a path with someone, even if you're quote unquote more recovered than the other person. It's still a journey you walk together, and you learn mutually from contact and from connection. So it's about self-understanding, and then in that you can kind of come to a place where you can understand others. Does that
Yeah,
sound?
I'm to steal from substance abuse, you know, their thought is whoever got up the earliest is the longest in recovery. And that kind of goes with the mental health because you know we wake up and we may not be feeling good, we may not know what it means, you
Sure.
know. The next day we wake up and we're happy and go lucky, and so I think that you know learning to go with the flow of that and not becoming overburdened
Right.
when we do have some bumps in the road.
Right. There's in that I hear like there are many roads to recovery. There's no straight line,
Yeah,
and it's not a so it's not a paint by numbers. It's really a kind of um, complex, oftentimes multi-month, multi-year process where you recalibrate and you become perhaps somewhat a different person, maybe more yourself than you were. But
yeah,
I always felt that it was a process of particularly for me, it was a process of certainly learning and also making those connections with others that people who have gone through similar experience and finding that where the place that I was coming from was one of there not being an understanding and being overwhelmed by it with gratitude that there were people who were gone down similar paths. So um, yeah, so um, hope seems to be a pretty
yeah.
big factor in all this. Is that I certainly had struggled with that for some time, kind of lost within a circle of people that did not kind of understand what I was going through, and it was difficult to find hope in that. But there it still was, and I reached out to NAMI at some point and got connected with a peer through the community mental health center, and my eyes were opened, and hope actually became a part of my life. And yeah, I think hope is absolutely critical. Um, um, yeah, that
And I
that
think, you know,
yeah,
to realize as we're talking with other people, other consumers, other people with lived experience, we find that even though we may have similar diagnosis, it doesn't mean we work the same program. We
Right,
we have to find our own groove,
right,
of what makes it work for me. And like if I'm in a really bad mood, if I turn on some music, I can get lost in the music, which helps me settle down, look at myself, and then be able to move past it. Sometimes things are just, somebody may trigger something. And as you get further in recovery, you find out that you can either fall into where that trigger takes you, or you can say, wait a minute, this isn't happening today. This isn't a reality. And bring myself back to today
right.
and proceed with my recovery that way.
So back to just knowing yourself through a period of listening to yourself, listening to others, getting feedback, but also ultimately, it's that kind of um, awareness of your own body, of your own mind, what you
Right.
need in terms of your personal medicine. Um, the other, I guess, the other kind of thought that I wanted to address before we get booted off, if that might happen. I have to ask Itzel, but what our time is. But this idea that it's you find your personal medicine, but it's not necessarily the medications you're taking. It could absolutely be the medications you're taking, but there are other things. Is the
Hmm.
interesting thing is that you find in the peer community and you find in the recovery approach, if eating chocolate is your kind of, if that makes that makes you feel better, then that is it. That's part of how you've recovered and part of how you take care of yourself. If doing meditation is part of it, if seeking other holistic means of taking care of yourself, then that's the solution. There's no one way about it. And maybe perhaps in the history of mental health, um, psychiatry kind of dominated um, the scene in terms of what people could do or expect about recovery, about their own well-being, and about the medications they take. And I think we've moved on in a pretty profound way um, with the peer movement and with the recovery movement to empower people to make their own decisions about their level of care, their treatment, the kind of treatment they receive. Um, that I think that idea is really critical to that sense of self determination is really key.
I
Uh,
know one of, oh, sorry.
no, no,
I know
go ahead.
one of the things that really comes out, and especially, in some of the groups that I have been involved in, is that um, the creativity comes out. People with mental health issues tend to find themselves in a position of, if they're exposed to it, creative ways of coping and expressing themselves. And I know for myself, I never thought of myself as an artist or a writer, but I do both now. And some of it is good, it's not all good, but some of it is good. And there is a history of Van Gogh and Picasso and some of those early artists that um, they they painted or described their um, emotions through their painting.
Sure.
And I think that when you start looking at that, there's a lot of famous people out there who have found a way to make it work, even with acting and drama, different things.
Yeah.
um, we let that come out. And I think before, at least for me, I was afraid to let it come out because I wanted to be perfect.
Right.
And there's no such thing as perfect.
No, no. And on that road, you find your strengths. You find the things that that perhaps you were meant to do. That you've walked a road. It perhaps wasn't your road, and then you find um, a rupture, and then maybe you move on and discover things like, writing or painting or some means of expression that kind of was always in you, but you didn't quite
Know
didn't
how
have
to
access.
tap it.
Yeah, yeah, yeah,
Yeah.
absolutely. Um, yeah, yeah. Um, in terms of further discussion about peers, I feel like um, there's that sense of a there's no power differential. There's that sense of, in my thinking, it's like in all my experience with peer support, both giving it and receiving it, I always felt like I came to the table with someone who respected me and acknowledged, that my experience was legitimate, that
Right.
I'd gone through these travails, I've survived them. I got congratulation about having survived them. There was a recognition there and a respect that I didn't expect, and so um, that's always been a huge part of peer support for me, is this kind of notion that um, you're on the same playing field. You're kind of at the, sometimes at the ground level together, and it's always been a comfort to me um, that there are people out there who can kind of communicate in that way. But and these people are the people that can help foster people who are peer specialists and peer support people are very good, in my experience, at fostering some of that inner reflection, that inner understanding, and also certainly help get it out of you, and help you express, your own particular take um, on life, and your own emotions and feelings. Uh, that's all I have. If there's anything else, Gina, that you thought might be important to
Well, I think the
share.
other thing that I just want to catch on is one of the things with working with peers, like you said, you're on a level playing field,
Sure.
but we can also help them understand what the treatment team that they're working with, what their roles are, and how that affects us, but we still have a voice. And
Right.
I think that we've come a long way from not having a voice about how to handle our mental health issues to having a voice and being able to say, wait a minute, I don't want to go down that road, but I'll try this road, and there's that. I liked the idea that you said there's that respect, because that's really what it is. People are, whether it's our med providers or therapists or whoever, are beginning to understand that we do know a little bit about ourselves, and are accepting the fact that we can direct ourselves in a lot of ways with the help of others.
Right. Totally. Exactly. And that's specifically in terms of being an AOT specialist. That's the role. The role is to be a voice, to be the conduit through which, the person who's the client, the person who's the peer, a way to communicate for them in some respects, and to advocate for them um, to the system. And it's a wonderful thing that's going on, is that the mental health world, the mental health system, the structure of things is becoming receptive through the voice of the peer, um, to the concerns of the clients, and our peers, patients within the system, but to us equals. And that's a really kind of an amazing thing, I think, because they have their own agency, they have their own capacities, and it's and strengths. So it's about fostering that. Um, yeah, yeah.
Are we ready, Itzel, to move on? Is it time?
Oh no, we're still good on time. I do appreciate you both for your discussion. I think what as we've previously mentioned, I think in the second session, the importance of giving a peer a voice. And, as you mentioned today too, it's the voice in their own recovery and the voice and to be able to kind of have some help along with their treatment that they're going through, because again, the peer is the expert in their own story. They sometimes more services are necessary or less services, or depending on what they're looking for, but their recovery completely depends on the help they're receiving, but the same way making sure that they're being respected throughout the entire process as well. And as Chris mentioned, it's great that we're kind of taking that step forward and making sure that the voice of the peer is being heard, not just with mental health, but in general, in all aspects of everything. Peers and consumers, their voice is out there now, and they're deeply taken into consideration with different aspects.
Yeah,
Absolutely.
I hear that.
And why I
With AOT, I think what happens is, they may come in at first not sure that they want to be a part of, but as they sit around and we discuss, and it's not we tell them, we discuss, they have a part in it. Then once they have a part, then once they're engaged, they're more likely to be successful. And they can come in and say, "Hey, I had a rough week, or I had a rough month, but I'm still okay. I didn't go off my meds, or I didn't do this, and we are very much about rewarding the fact that they are finding ways to cope differently."
Yeah, and with that, I think sometimes one of the common misconceptions with AOT is that a peer is being forced into this treatment. It's involuntary, they don't want to do it, but really they do have, their voice is still heard. And what makes AOT awesome, and and the research is there, is that through that validation and that motivation that the participant is receiving throughout their course of treatment with AOT, that's really what's motivating them to continue on, because they feel heard. They know that there's a
Hmm.
treatment team that's working alongside with them to make sure that they receive the treatment that they need and the help that they need. And sometimes for some participants, that's never happened before. They haven't received that type of care that allows them to receive those wraparound services that will help them in the long-term aspect of they will recover and they'll get out of that revolving door cycle.
Yeah,
Yep.
I think that the thing that I see um, is that they sometimes come in apprehensive at the beginning, the first meeting or two, and as they see that the treatment team is not freaking out or having a meltdown because they're not doing everything perfect or right, they find relief in that they can express themselves, and they learn how to express themselves in a healthier way, and that people listen to them, and that the judge and the mental health centers and the peer is helping them to find a better way to communicate and ask for their needs to be met.
Mm.
Yeah, I agree completely with that. Like what I mentioned previously in the AOT section is that with AOT, if an individual, one of the participants doesn't go to the court docket, or they're not making their appointments, or they stop taking their medication, they have that safety net where they know they're not going to get in trouble. What's going to happen is that, their treatment team, if it's their provider, case manager, peer specialist, we'll have that conversation with them. What do you need help with? How can we help you? And I think for, when it comes to mental health or some of these peers, that might be the first time that they're receiving that sort of treatment, that they know
Hmm.
that they have, if something
A
is wrong,
voice.
yeah, they have a voice. If something is wrong, their treatment team is going to find a way to help them.
I
And that's hopeful, and
agree.
that's where hope factors in, I think, as well.
Yeah.
for the individual, the peer.
I know it's very, very exciting. It's been very exciting for me to watch some of the people who have come, the AOT participants come through, who are really against it to start with, and watch them blossom as they understand and engage themselves and become more willing to be a willing participant. To watch how quickly life changes for them and how it gets better. And when they see it getting better, they understand that, you know, um, I had a part in this.
Yeah, definitely. I think that is one of those rewarding process that we've been seeing with AOT. Not just in, within the pilot sites here in Kansas, but all throughout the country. We've
Mhm.
been seeing those changes with any county or any state that establishes an AOT process. Well, before we move on to the following section, do you have any closing remarks?
Um, I don't. If Gina does, then certainly should listen.
Thanks. I don't think I have anything. I think that I just feel honored to be able to share with you guys, to
Thank you.
educate. The more
Thank
we
you.
educate people, the better we are, the less trauma we'll have.
I completely agree. I think education really is beneficial when it comes to, individuals that understand and that have that experience.
Totally agree.
So moving on to that following section is discussing a little bit more about resource that NAMI has. Uh, to help with peers. So that would be NAMI peer-to-peer, and then the section Gina will be discussing a little bit more. She has facilitated multiple peer-to-peer sessions and is a lot more knowledgeable about the class than I am. So Gina, I will turn it over to you.
All right. Um, Peer to peer is an um, p- uh, 8 weeks of education. You're finding out about yourself. You're finding out what is a truth, what myths maybe be going on. And these sections that I have are each are one class. So there'll be more slides, but getting started, your first day there, they explore different viewpoints of mental health and recovery, and they create a personal vision statement. And in that, what we do is we help people find out um, how they're responding, how they are recovering, and where they are in their recovery process. Class 2 is the brain and the body, and learning about the relationship between mental health and physical health. And I think that's really, really important because um, they're not separate entities. They do go together. They do, what's happening in our brain, what's happening in our body. There's a relationship between that. Um, and so um, we start and educate them on SMART goals. And SMART stands for specific, measurable, attainable, realistic, and timely goals. And I think that the thing I like about the second one is one of my favorite because um, we talk about the different diagnoses as well as clarify different treatments for different diagnoses. Not all treatment is the same. One treatment does not fit all people. And by educating them, they may find that there may be a better way for them to get help. And the whole idea between the education is for them to understand themselves. Class 3 is telling my story. And when we first get into it, we um some people, we want to tell all the gory details. The next one wants to, stay on this. So we help them realize you can tell some of the past, but we also want to explore and talk about the positive since you've received your diagnosis, because things have changed and your story is a little different. And maybe you know, it gets to a point where we have the understanding that I have to take control of this, and I have to understand what part of the body is responding. Um, so in telling my stories, what we do is we identify um, a pattern for which people can. I'm going to look back at that real quick. We talk about um, the different dimensions of wellness. We talk about the emotional, the financial, the social, um, dimensions of your life. When we get into storytelling, we talk about behaviors. We talk about how we respond to situations. We learn we learn to understand um, what our different diagnoses are and how that plays a part in our recovery. And um, and I will just say that at the end of each class, there's additional um, resources available for people to look up on their own. We want to go to the next slide, please. Class 4 is about strengthening our relationships. And with that, we learn how to say I statements. We learn how to communicate without judging. Um, when you say an I statement, people can't argue with that. If I say, okay, I feel this when this action takes place, or when somebody says something, maybe there's a trigger in the language. We learn about those. We learn about um, communicating and being responsible for what we say. We learn that words have impact. Um, and in that impact, that that um my brain just went dead, sorry. um with that impact, the relationship could be intact, because maybe the person I'm talking to, maybe it's the tone I'm using, maybe it's the attitude I have behind it, and maybe it's just the word itself, because a lot of people, several people, or a lot of people with mental health conditions find their triggers are either words or phrases or smells or situations. And so if there's words, what we learn is that we can discover what words kind of set us off, and we can start realizing that when, I can say to the other person, okay, and I'll just use a real example in mind. Please don't call me sweetie. When I hear sweetie, that takes me back to a time in my life that was not okay. So I don't like that word, sweetie, or at all. And so if I'm in a relationship and they like to call me sweetheart or sweetie, I have to explain to them that, I appreciate that you're doing it. You're meaning it in a positive way, but my body is responding and my mind is responding in another way. And if I can help somebody understand how their language is affecting me as a mental health consumer, then that can help build our relationship. Um, you know, I don't like it when people curse. And that makes me think of when I hear somebody, sailor talking, whatever you want to call it, it takes me back to a time you know, that wasn't a safe environment. There were, for me, it was bars and the group of people I hung around that talked like that. But that wasn't a safe environment because I wasn't in a position to be able to protect myself. Because for me, when I was drinking, I became vulnerable. And so, we have to know those terms. We spend a lot of time talking about I statements and we practice. We do a lot of role playing in, excuse me, in class 4, so that um, we can feel good about saying, I feel this when, or when you say this, I feel. They can't argue with the I feel. Um, they may not like it, but there's really not there's not room for them to argue. Class 5, we grow support networks, um, and we find out the different areas of support that we need. Some people are in our lives that are just on the outside of the circle. You know, I see them during certain situations, and so they're kind of the outside support. When you get to the middle of the circle, and it's the people that really mean the most to me, it's not going to be as big as the outside circle. So as we're working on building support networks, we give them a chart with a circle on it and ask them to fill it out. And it's amazing, when they do this, they either find that they have a lot of outside circle, which means they have a lot of um, network, but they're not very close. And there's they find that they don't have but a few people in their inner circle. And, and we can, we help them to realize that that's pretty normal. You know, if your inner circle is huge, um, and not that that's not good, but sometimes we think that they're our inner circle and they're not. They might be your network could be professionals, um your church, your family, and sometimes family doesn't end up in your inner circle because we have situations in our lives where we have messed with our family and they don't trust us. And so, as we're learning to discover ourselves, we have to learn to build um, that relationship, help heal that relationship for to that family relationship to be reunited. And it may never be as good as we want, but it can always get a little better. And that's what we work with, and we have them fill that out, and then they look at it through different times of the next 3 weeks that we're there to see have some of those things have changed as we understand ourselves better. One of my inner circles is my therapist because he knows it all, and I can go to him for support. um, but not everybody has that. The Somebody else might have their inner circle as being their child, uh, their spouse, maybe a best friend from long-term best friend, and those are part of that inner circle too. But just figuring out where they go and where they fit in my life was eye-opening to me because my family actually was pretty far down in my circle because um, of circumstances And because mental health was not allowed to be talked about in my family. So if you can't talk about who you are, what do you have to talk about? The weather. Give me a break, Uh and so I had to look at that, and that helped me not take everything so personal. It helped me realize that, for me, God has put people in my life that are in my inner circle because my family is not, other than my son. My son and his wife are in my inner circle, but you go back to my birth family, things like that. They're not in there because they don't want, part of it is they don't want to be. They don't want to be educated. Um they don't want to know about that. And part of that probably was my fault because I talked too much about the trauma before I knew better. you know Now I know that I don't have to give details about the trauma. I can talk about it if I need to, but it's not the most important thing in my life. The important thing is recovery. The important thing is moving forward. And so, that's kind of what class 5 does. Class 6 is about responding to stress effectively, learning different types of therapies and medications, and looking more closely at goals. And when I think about it, um, learning different types of therapy, I did not have. I mean, I knew there was different types of therapy, but I didn't know there was uh, therapies that worked well with certain diagnoses. That didn't, this really was an educational part for me of finding out that, you know, the therapies and the medications, you know, um, go according to what the diagnosis is and what works best for you. And that was just really an eye opener for me, um, on that. Some of them are, and I can talk more about that if we need to at a different time. Number 7, my story, my strengths. Understanding personal stories in a new way, and preparing for conversations with mental health providers. One of the things that NAMI is very prone to helping people is helping them have conversations, to letting their providers know what they need. It's not necessarily what you think I need, but what I think I need. And preparing my preparing my personal story, you want a little bit of the past, but you want a whole lot about recovery, because you can lose people, you can trigger people if you talk too much about the past and the trauma. And the whole idea about telling my story is not to traumatize somebody else in the group. uh, the purpose of telling my story is to provide hope and to give clarification that you can recover, and that recovery is real in our situations, and that I do have strengths that I can utilize when I'm in a situation. I do spend a lot of time um, helping people prepare conversations for not just mental health providers, but a lot for the physical health. I I spend a lot of time with consumers, and they're getting ready to have a procedure or a surgery, and I go in with them. A lot of times I go in and we talk about their medications and why it's important. And you know, doctors, I'm sorry, they know what they know and they don't know what they don't know. Um, they'll say, okay, don't take any of your medications 24 hours before you have the surgery. Well, okay, but I may not be the right person when I come in here for surgery if I've been off my meds for that long, you know? And are you going to give them to me when I get out? And what I have found is a lot of hospitals don't want to give the psychiatric meds They're not prepared for that. So it's our job to educate them about the fact of what we need and what we don't need. And how quickly I can get back on my medications once the procedure or the surgery is done. Um, and a lot of times, what I have found, especially here in Hayes, is the doctors act like they listen to you, but then at the same time, um, there's nothing in your chart about it. And so, we have to um, educate these people, educate the professionals, the doctors, about what works for us and what doesn't work for us. And one of the things that I talked about last night, I did a family to family presentation, and I talked about the fact that I had to have this conversation with um, my granddaughter because she got a diagnosis and she didn't want to take medication. And so we sat down and talked a little bit, and um, Granny told her, you wouldn't like me if I wasn't medicated. Medication is there for a reason, and it's to help me be a better person in the real world, and being able to talk about that and understand that, you'll find yourself being able to advocate for yourself a whole lot better. And that's part of what NAMI is about, is advocating. Um, and then moving forward, oh, wait a minute, I wanted to do this. Okay. The story of the five blind men and the elephant. And I think this is really um, pertinent for this group because it will help understand. Let me get this 7. Um, it helps you understand how we think. So every story can be told from more than one point of view. Okay, and then this is the story of five blind men and an elephant. Each one touches a unique part of the elephant, and it felt very different. For one, the ear felt like a fan. For another, the trunk felt like a snake. For another, the tusk felt like a spear. For another, the leg felt like a tree trunk. And for the last person, the tail felt like a rope. Well, those are all parts of the elephant. It's one elephant, but depending on what viewpoint we take or where we get educated from is how we interpret it. And so no man is wrong. They're all right, and they're all describing an elephant, but they don't have the full detail because they're blind, so they can't see the whole picture. And that's what we have to do. We have to help them understand the whole picture of who I am. In class 8, we revisit personal visions, um, planning for the next step. We give them a lot of educational tools at the end, resources, so that they continue with this education, and they can do it as in-depth as they want or as little as they want. And the one thing that I love about peer-to-peer and family-to-family is you spend this intense time with each other. And so you've already created a network of people who know more about you than even some of your best friends, because you've divulged things here that you wouldn't necessarily divulge somewhere else. So um, that's kind of how it is with um, peer to peer. And I love teaching it. And I love, because every time I get something new out of it, every time I teach it. And, I have some classes that I really like. And they also, in the classes, they have different um, meditation and stress reducing exercises. And so where we teach that so they can do that at home. And so that they have a tool that they can use for themselves. And that's basically, I mean, that's basically an overview, and it's a very broad overview of what peer-to-peer is about. But after spending 8 weeks with somebody, you feel like this group is part of your almost inner circle, maybe the next one over, but they know more than some people that you've been friends with for a long time, because you've had to divulge into yourself, and you're growing and you're telling your story and you're finding your strengths and you're finding networks. And so it's very much educational for the peers, and it would be good for AOT participants to have a peer class. Um, it would it you know um, it would educate them, and I think sometimes for me, education is a big part of it, and it's not so much that I'm very learned, but the more I learn, the more I can know about me. So that's mine.
Thank you, Gina. And this is um, primarily why with a lot of our AOT participants, we do we have those NAMI pamphlets that we hand out, and it's for NAMI peer-to-peer, NAMI connection, and our family resources. But I agree with Gina when that NAMI peer-to-peer would be a really good resource for participants of AOT once they're comfortable and ready to go through that. And NAMI Kansas does offer NAMI peer-to-peer virtually if necessary, and I know some affiliates also offer it in person, depending the area you're in. But as Gina went through all the 8 classes, the information is really insightful for any peer that goes through these classes. And what we see sometimes is that uh, sometimes a person will take this class multiple times, and they took it one time and they learned all this information, and then they take it again because they want to really solidify what they've learned. There's individuals that like taking it once a year so they could get always have that knowledge fresh in their minds. And there's also the individuals they enjoyed the peer class so much that they go on to then train to be facilitators. And then they could openly facilitate peer-to-peer classes themselves. So that's a great resource if any, especially with any of our AOT participants, if to really suggest them looking into AOT, because I feel like with NAMI peer-to-peer and really any peer resource, it's important that the peer makes that decision themselves. They have the resource there, they have the information, and then to go along themselves and decide if they would feel comfortable with the class. Sometimes it seems a little scary. I think, the sharing portions of it and may be a little bit uncomfortable, but these classes do provide that security, that confidentiality, where eventually a peer, any participant that goes through NAMI peer-to-peer, they're able to feel safe, and they know that they're able to openly discuss any of these topics as they come up and as they really gain more information from it. And uh, following this conversation with the peer-to-peer, we are also having more of a conversation on NAMI connections. And what we decided to do really was to show what a NAMI connection class would be like, because we often receive the question of, well, what's the structure? What's the benefit? How are these classes really, how are they ran? And what we decided, instead of trying to explain what the support group would be like, Kathy, who leads many NAMI connection groups, she really is an expert with NAMI connection. She decided that we will kind of demonstrate what a NAMI Connections group looks like during this session, just so everyone could see that themselves and later on recommend it to any AOT participant or client in general. So I will now be turning it over to Kathy um, for this portion of our presentation.
Okay. So I facilitate 5 to 7 groups a month, and I didn't want it to be where I've repeated information already on the first group about what this is, and I know I get asked a lot of times like what exactly is a connection group? Well, I can tell you, but that doesn't really tell you what a connection group is unless you've experienced it yourself. So hopefully people will be able to watch the video later and um that will answer some questions. So I'm gonna get started. Um and there will be times I will stop and let you know what I'm doing and why. It won't be a full connection group because a group is 90 minutes long. We have to stick to that. So um anyway, we're gonna get started. And it's just gonna be the 4 of us in the group, so I'm not gonna call on anybody else to answer anything or do anything. Just to watch and listen and learn. So let me share my screen. Okay. Welcome to NAMI Kansas Connection Recovery Support Group. Where's my okay. Group safety and confidentiality are of chief importance in our group. Confidentiality is only broken if someone is at risk to harm self or others. In the state of Kansas, there is a mandated reporter statute, meaning if there is suspected risk of harm to oneself and or another person, we may need to report it to the appropriate authorities. Kansas law says any mandated reporter who thinks a child or person 65 years or older or an adult with disabilities is being abused, neglected, or exploited, we must report it to authorities. When making a report, we may be required to break confidentiality. We want the group to know we do have a dual role here, and it is for everyone to feel safe. And I am a mandated reporter. So if I hear or see anything that needs to be reported, then I will do that. The agenda, we'll do the welcome, which we just did. We'll read the group guidelines and principles of support. We'll do a check-in. That's usually 1 to 2 minutes. But that we can vary that. If there's only a couple people that show up to the group, then we can let them have more time. If we have a large group, we have to be sure we stick to that 1 to 2 limit. Sometimes we have groups where only one participant shows up. They can have the whole 90 minutes to themselves. And sometimes that's just what they need is to have that time and have 2 people just sit there and listen to them and focus their attention on them. After the check-in, we do a group discussion and we do a closing. Okay, please keep in mind the resources on our website, www.namikansas.org. This group is for individuals ages 18 and older and who have mental health conditions. As this meeting is online and over the phone, please keep your phone or computer microphone muted to avoid background noise while someone is talking. Also, please be sure you unmute your phone or computer microphone when it is your turn to talk. Now let's read the group guidelines and the principles of support. The group guidelines tell us how we are going to care for each other in the group. They provide the mutual consideration, acceptance, and protection that are often hard to find in the real world. We will follow these guidelines at each meeting to create the sanctuary and safe place we need. Okay, number 1, we'll start and stop on time. 2, time limit for check-in. 3, absolute confidentiality. 4, be respectful. 5, be mindful of others, no interrupting or monopolizing. 6, keep the conversation in the present. And 7, empathize with each other's situation. The principles of support represent what we are striving for as we struggle to come to terms with mental illness. This is our belief system regarding universal, necessary truths that guide and strengthen us when life deals us this particular challenge. So I'm going to read the first three. On number one, we will see the person first, not the illness. Number two, we recognize that mental illnesses are illnesses that may have environmental triggers. And number three, we understand that mental illnesses are traumatic events. Who's taking the next three?
4, we aim for better coping skills. 5, we find strength in sharing experiences. 6, we reject stigma and do not tolerate discrimination.
7, we will not judge another's pain as less than our own. 8, we will forgive ourselves and reject guilt. 9, we embrace humor as healthy.
10, we accept we cannot solve all problems. 11, we expect a future that is ours to shape. 12, we will never give up hope.
Thank you. Okay, where's my, doesn't want to show up. Okay, by a show of hands or by unmuting your phone and saying aye, can we agree to observe these group guidelines and accept these principles of support during this group? Aye.
Aye.
Okay, so now we're going to go around the circle or square, rectangle, and ask you to briefly tell us your name and what is happening in your life right now. We've set a time limit of 2 minutes each, and our hosts will keep time, so we will have plenty of time left to talk together. I'll be taking a few notes so we make sure to discuss the issues that you all brought today. All notes will be destroyed at the end of the meeting to ensure confidentiality. So the reason we take notes is so we can remember what each person has talked about and we know what we need to come back to. And to identify if there's a certain theme going on that we need to address. So, but we do destroy those. As a reminder, we are on the phone and online, and muting helps make it easier for everyone to hear the person speaking. Remember that we have a pass rule. Anyone can pass for any reason. And I am going to start. I'm Kathy. I have CPTSD, depression, anxiety, OCD. I had borderline, but it was just removed. So, yay. I have other disorders as well. And I'm going to pass on how my week was going. So, Itzel, do you want to go next?
Yes, I am an individual with anxiety disorder, and this week was just, I think it tends to be a little stressful whenever I have to do anything that involves being out in the open, as I call it, out in the wild, socially interacting with other individuals. That's always triggering, it involves being with a lot of people. So this week I really only went out once, and that was out to the grocery store. But thankfully did not see many people. And I think that just really helped me feel a lot more at ease when out in public.
Okay. Is there anything, if we were to have a discussion group, is there anything that you'd want to talk about later?
I think that I guess it would be more on how like this week there's an anniversary of there's 2 anniversaries of family members that have passed, and so I know that this upcoming week will probably be potentially triggering depending on how the week goes, or how, as always, just the grief will sometimes climb up.
All right. Chris or Gina, who would like to go next?
I'll go next.
Okay.
I'm Gina, and I have major depressive disorder, PTSD, and DIDS. And this week has been fairly good, except I got anxious about doing this today. And but it's been a good thing, and I've really enjoyed the sunshine. I'm not looking forward to next week when it's supposed to be rainy, because I tend to have seasonal affective disorder sometimes. And although I've been in recovery for a while, it still sometimes sneaks up on me. So, but I'm doing okay today. Thank you.
Is there anything that you would like to discuss later?
Not that I can think of yet.
Okay. And Chris, how are you doing?
Hey, yes. My name is Chris. I have schizoaffective disorder, which is combination of um, major depression as a mood disorder and some peaks of mania, as well as delusions and hallucinations. I hear voices in my head and certainly have subscribed to some odd beliefs here or there once in a while. Anyway, my situation. Do I go into my situation or do I? What do I do next?
Go
Am I?
ahead. Tell me what's going on this week.
Well, what's going on is I have a new girlfriend, relatively new, and I she feels like I need to be working. I've been in recovery. I believe I've been in recovery for a number of years. Uh, she knew coming into the relationship that I would not that I did not work, but now she's assuming that I she thinks that I need to now, and so I've gone off and I've gotten a job, and it's selling clothes um, at an outlet, at a clothing outlet, and it was okay for a while, but now my anxiety's gotten so severe that I'm having a hard time showing up and getting my responsibilities filled. I've called in sick. I've done a few other things, but it's becoming a real problem, and I haven't told her about it. And I'm really starting to panic that she might leave me. Long story short, it's really been very stressful.
Um, all right. Well, thank you for sharing that. And we're gonna start with you, Chris. So here's where I'm gonna explain stuff. As facilitators, we have a facilitator guide that we have to have with us at all times while we're doing a group. And Chris just brought up something, a traumatic event, and we call that a hot potato. So that's where we start first with in the group. We have to address any traumatic events first. We have a script, and that's what I will go by. It helps when you have this right here because you don't have to think of how you're gonna handle whatever traumatic situation somebody brings up. So I'm just gonna keep going with Chris's event that he brought up. So that's what we're gonna talk about because it's really hard. For myself, I haven't had the experience of somebody um leaving or telling me they're gonna leave, or I haven't had that experience like that. But I can relate, and part of it because as for jobs, whether paid or volunteer, um, sometimes I only last a few days because the anxiety is so high, and then I have to leave. Um, for working online, it really suits my purpose. It helps with the anxiety issues and everything. But um, there are times when even doing online work, doing Zoom groups, and like Gina mentioned, I also had anxiety about this group, but it's a little bit easier um to work online. Um, but I have left many jobs because of the anxiety. Um, Gina or Itzel, have you gone through anything similar?
Yeah, I think I really, Chris, I really connect with you when it comes to going through a breakup like that. I think really does just change up mindset, not just for a day. I think it's a week or it's more. I remember when I went through my last breakup, it was just difficult to do much, and I agree sometimes with the pressure that a partner could bring. It's hard to meet probably their standards, when it's something that you won't be comfortable with. So, Chris, I think I definitely um really really understand what you're going through and definitely here if you need anyone to speak to.
Thank you.
Uh,
Yeah, my problem with jobs is more that I open my mouth too much. I don't get anxious. Well, I get anxious, but I hide it through over talking. So, so I've had to leave jobs because I share too much. And so I've had to learn to tone down myself, but I have experienced where a significant other person had expectations of me, and they weren't very understanding of why it was difficult. So I definitely relate to that, but mine is just a little bit different, so that's okay. But I'm here for you if you need me.
okay.
Thank you, Gina.
I'm gonna share my screen again, if I can find my screen. Okay, and we have what we call the emotional stages of recovery, and um, you can be in all three stages at one time, go back and forth. Um, like for me, example, when I'm in work mode, like I'm in right now, I am in stage 3, but the past week I've been pretty much in stage 1 and 2 all week long. So working puts me in stage 3. Um, Chris, what what are things that you need right now? And you can go through this, uh, look at the emotion stages, see if there's anything that you need. Um, tell us where you think you are.
Well, I'm all over the three. It looks like um, I'm I feel like I need to restore balance in life. I don't know if that's, yeah, that's a huge thing. I think I need to. I feel like I need to um, realize who I am and my own worth, and uh, take a firm stance on um, and not try to meet my girlfriend or ex-girlfriend uh, at her door. She can meet me halfway, and I think that would kind of help a certain sense of I don't know, balance. In terms of the power situation, but I'm also in need of just um, part of it is like permission to be numb, because I'm really, my anxiety is through the roof. My sense of loss is pretty deep, and I feel like you know yeah, I think that's pretty much where I'm at.
Right. Gina, where are you at in the emotional stages?
I think I'm between 2 and 3. I'm still learning about myself, so I'm learning about being positive with my self-care, but um I really like restoring balance in my life. I think it's been a little chaotic. Um and finding meaning in life, that's really where I'm going towards. So I'm in three more, but I have some areas of two that I have a little bit of that I'm working on. Thanks.
Itzel, where are you?
I think I think personally, in number two. I feel like I have that recognition of the things that I consider to be triggering, and um, then also with that grief, that's that ongoing grief that is always there. So I think definitely, you know, kind of having that permission to vent my feelings and then also being mindful of that self-care. I think that that part is always important, especially anytime that I am in that second stage.
Okay, thank you. So about the emotional stages of recovery, we don't always go to this. If somebody is showing just maybe some intense emotions when they're talking, then we'll go to the emotional stages and just check in with everybody and see where they are. Um, and as facilitators, we cannot suggest to anybody where we think they are, what stage they might be in, or what we think they might need. We can't do that. Um, so let me go back out, stop sharing. So, Chris, how do you think the rest of us in the group that, how do you think that we can help you with the needs that you have right now?
Well, I'm just glad that everyone shared and you know, it's nice to hear other people and going through similar circumstances and it gives me a little bit of comfort to know that I'm not the only one. And yeah, just being able to share it was nice, and then of course to receive um, the news that other people are out there and are struggling too with similar stuff.
Does anyone else have any group wisdom for Chris?
I'm just glad you shared, Chris, because I hadn't thought about that for a while, and yeah, I haven't been in a relationship for some time, but I think that's a fear I have.
Um, yeah, just appreciate you coming here and sharing today. I think, just like as Gina mentioned, sometimes it's just when you haven't gone through something here recently, uh just hearing the perspective of someone else really puts it into place and really also when it comes to your the issues with the job and all that anxiety also kind of putting that into perspective too, that I'm not alone when it comes to those emotions, as we all saw today. I think we all experience that, and it's always really insightful to see that I'm not alone in it in the process of everything I feel.
Chris, I just want to thank you for sharing that, what you did. And like in discussion later, we can talk about maybe some coping skills everybody has for getting through anxiety, or what you do or what we each do when we go through some loss situations. I am going to share my screen again. And we're going to look at the principles of support right now. When I am going through really difficult times, I kind of lean on Number 10, we accept we cannot solve all problems. And number 12, we will never give up hope. And then I also, 5, we find strength in sharing experiences, hearing other people's stories and how they cope through their own issues helps me. And I don't have a problem in sharing my stories because the hope is always there that somebody's gonna get something out of that. Um, Gina, what principle of support do you use when you're going through, your hard stuff?
Um, I think 5, we find strength in sharing experiences. And I try to remember, I have to remember that I have to forgive myself. Number 8, and reject guilt because it's just an experience I'm having. It's not the end of the world. It's not, you know, I have to remember that. And I have to remember that, you know, that I have to forgive myself. I fall back in those patterns, and it's something everybody does at different times, and that, and not to get stuck in the guilt. Thank you.
It's all. What about you?
I think one of the one I always go back to is that number 12, we will never give up hope, because I think it's important that no matter what we are going through, never giving up hope is, primarily there. Um, and then also the um number 8, we forgive ourselves and reject guilt, because no matter what the experience is, when it comes to my situation, it's not being comfortable being out in public. So then that um understanding and giving myself that grace that I know and shouldn't feel guilty because because I'm deciding not to put myself in the situation that would make me uncomfortable, or that would be triggering.
Okay. Chris, what principle of support might help you right now with what you're going through?
Um, I think number 6, we reject stigma and do not tolerate discrimination. I think it's good, a reminder for me to appreciate who I am, regardless of, other people's opinions, that I am a valued person and a valuable person, and um, even people that I let into my inner circle need to appreciate that and understand that and accept that, even if they have goals, that I myself can't uh, easily reach, or even want to reach. So,
Okay, thank you for sharing. The principles of support help us to focus on hope when times are tough. We recognize the courage and determination of each member of this group for getting through traumatic events like these. Stop sharing. So that's how we handle um a traumatic event. And if there's other people that would have had trauma issues, we would have just done all of that, at gone through all of that. Um, if we were having an actual discussion right now, um, I would look at my notes and see if we had any common themes. And we would talk about that. Maybe it's a week where everybody just is depressed for whatever reason it's depressed. So we could just talk about depression and maybe depression coping skills for depression, healthy coping skills. We always have to remember to say healthy coping skills, because not unhealthy coping skills. Um, Sometimes there's no common theme, so we just ask people to share, um, if they want to. We do have a pass rule, no one has to share. So like if we were doing a discussion, then I might ask Gina to talk more about um, you know, the anxiety about the seminar today that we're doing, or maybe about um the weather and how it makes her feel. And that could promote discussion, everyone else, bringing up like, well, this is how it makes me feel as well. Um, and for itself, she mentioned anniversaries coming up. So that's probably where we would let's talk about some, if you want to talk about it, let's talk about these and see, if there's any, you know, advice anybody has, any wisdom anybody has that could maybe help you get through these. Now, if all else fails and nobody wants to talk and has anything to talk about, we are trained in how to keep the meeting going. So, like I mentioned, the coping skills, healthy coping skills, that's always a go-to. At least for me and in my groups, we always go to coping skills and self-care ideas. Gina had mentioned when in her talk earlier, that music is something that she goes to. So, I could bring up that. So Gina mentioned music. So as a coping skill. So what about the rest of the group? Do you listen to music? What kind of music do you like? What kind of music helps you? And that could be a really long discussion about music, from every type of music and what people like, or sometimes just sharing the screen and getting on YouTube and listening to the music people like. Um, so you can go a lot of ways with coping skills and getting the group to where it needs to be. Um, so so we've had our discussion and everything, and here in Kansas, some of us have adopted uh an ending to a connection group that we kind of stole from NAMI, Colorado. Um, so different groups in their uh, connection group different ways, and we are going to end our group with how many of us do it here. So number one, we state that we are safe. Two, we look at the principles of support and choose one for the next week. And then we state one nice thing we're going to do for ourselves. So I'll start. I'm safe, not a harm to myself or others. The principles of support. Um, um, hmm. I'm gonna just go with we will never give up hope. And for my self-care, my go-to is always nature, but that always depends on the weather and my health. And it's Kansas, so we can't really depend on the weather. So if the weather is okay this week and everything, my body cooperates, then I will try to get out in nature. I like taking lots of pictures. Um, if I'm not able to do that, then I will immerse myself in Lifetime movies all weekend and crochet, because crochet is a coping skill, positive one for me. Who wants to go next?
I'll go. I feel safe. I'm not a harm to myself or others. When I look at, I got a couple of these that I like on principles of support, but embrace humor as healthy, because I like, sometimes I'll watch a funny movie or something that makes me kind of get out of myself. So that's one of the ones I like. And I love 12. We never give up hope. And here's what I'm going to do this week for self-care. I'm going to take some time for myself and get outside while the sun is shining and not worry about what next week's coming up with rain and darkness. I'm just going to stay in the moment.
Yeah. My next newsletter coming out in June is on principal support number 9. So if you
Yay.
want to send me a list of funny movies,
Okay.
I'd really appreciate that.
Yep.
Um, it's
Yes. So I am safe. I'm not a harm to myself or others. And I think for principles to support, I going with 10. We accept that we cannot solve all problems. Because I think that is something that I always struggle with. Wanting to solve everything that comes to me. And I think this weekend for self-care is just maybe taking time for myself. I really like to step away from anything, some weekends like anything electronic, so I guess spending some time outside or spending some time with family, just trying to get away from any screens because since Monday to Friday we're in front of our screens a lot, so maybe on the weekends I like to step away. So that's my healthy coping skill for or healthy self-care for this week, and would be to just spend time with my family, or just to do some sort of activity outdoors if it's not blowing, the wind is not blowing like 100 miles an hour like it has been.
Are you going to celebrate your birthday this weekend?
Yeah, yeah. So that's my plan, to celebrate hopefully tomorrow with my family.
Good.
Chris, are you safe?
I'm safe. Principles of support. Um, we embrace humor is healthy. I would love to um, catch up on a few sitcoms that I love that I haven't watched in a while. Um, Also, this weekend, I want to meditate a little bit because my mind has been a bit overwrought. And yeah, that's pretty much it.
Okay. So that's pretty much what a connection group is. The short version. Um, Wherever you go, it's gonna be the same model. I do different, as needed, I do different groups in different states because we can do that. Um, and I know how the group is gonna go. I know that they're gonna hopefully be following the model. Um, the people are gonna be different, their stories are gonna be different, but it's gonna still be familiar and everything. So you don't have to go to groups where you are because a lot of groups are still virtual. You can go anywhere. Like last week, I went to a group in NAMI, Idaho. Um, so I think that's everything about connection groups.
Yeah,
So I'll hand it back to you.
Thank you, Kathy. I really appreciate that. Just being able to demonstrate what a connection group is like. I know we have received that question plenty of times on what it would look like and what it consists of. And the cool thing about, as you mentioned, with having virtual groups is that there's almost always a group that is accessible anywhere. If NAMI Kansas doesn't have one going on, an individual could look on the NAMI.org website, and it shows a list of different groups that are happening around the nation. So there's always a group going on for someone that is in that direct need. For the state of Kansas, you could find these groups on the NAMIKansas.org website, and those are really they're also open. Most of them are virtual or hybrid. There's some that are in person, and for when suggesting it to an individual, so these connection groups are usually, they have two facilitators. So what Kathy was, how she facilitated her group, she'd share those responsibilities with another facilitator, or sometimes there's also someone controls all the PowerPoint and anything involving technology, if it is virtually. So there's always two people there to be able to facilitate these groups. And with that structure, like Kathy really described throughout her demonstration, was that there's that structure that we follow that allows that facilitator to be able to connect with the people attending the group. And there's that structure helps when there's situations like with what the example Chris brought up with that hot potato, as we call it. And these facilitators are trained, they go through a training to be able to facilitate these groups. So with that, if anyone ever has any questions with how to get a hold of or how to find a NAMI connection group or a NAMI peer-to-peer group or any groups for the family members, you could always reach out to one of the four of us. We almost always have a current list of different affiliates around the state that are always hosting a group. And much like NAMI peer-to-peer, I do believe that NAMI Connection could be really beneficial for AOT participants, because if, it's always, as we previously mentioned, all those services that they're receiving, if it might be medication or therapy and such, sometimes that support group, that peer-led support group, or like NAMI Connection, that's like the recovery peer-led support group, it's insightful for them because they're able to connect, much like our demonstration today. If someone's going through something, more than likely another person in the group already experienced that. And then together they're able to help the individual get through whatever it is at the situation that they're currently experiencing. And that's and then there are also the ability to build friendships and connections. I know sometimes groups, whoever's comfortable will share their contact information, and then that they're able to communicate via, phone or Facebook and such, email, even when you're not in the support group. So, you've built that friendship with someone, and it really helps, again, with that peer connection and that peer networking that we see sometimes with a lot of our NAMI groups.
I forgot to add one more thing. There are many connection groups that across the country that are specific to maybe a different disorder or population or just anything. Like here in Kansas, I co-facilitate a women's group. We have a group for veterans and their families. Um, we have a group for the LGBTQ. I don't remember all the other alphabet letters. um, for anyone who'd like to attend that group. I've been to groups in other states just for the specific disorders that I have. There's a lot of cool groups out there that are I've seen groups just for crafts or groups. I saw a group, somebody has a group in another state, a gratitude group. All these things that I wish we could do, but that requires volunteers and people and trainings and stuff. But if somebody wants something more specific, they just, I can help them find something.
And some groups are, you have to have permission to join.
Mhm. Yes.
So if you find yourself finding one of those groups, find out how to get that permission so you can join it.
Yes, like there are connection groups for trauma survivors, and those usually you have to have permission, and sometimes those are because it's a trauma group, then because I've been in them and we don't like really go over the hot potatoes because it is a trauma group and it's expected that we're going to talk about trauma events, and they do questions and everything to make sure you're able to be in the group. But anyway, I think we've covered all of that. So
Thank you, Kathy, for that information. I think it's always insightful, really, to learn everything that is available for peers, not just in Kansas but nationwide, and the broad aspect of groups that NAMI National does offer, by individual state. So that really does conclude the information that we had today. And if anyone has any questions, like always, you could unmute yourself and discuss it, or put it in the chat box, or later on email us with those questions. And again, if anyone is interested in more information for our NAMI groups, or if you're wondering how your affiliate in your area can start up a group, also let us know. I think right now in Kansas, we're working on really expanding our resources when it comes to more volunteers and offering more groups. And so if anyone ever has a suggestion, or they know a person that would be interested, don't hesitate to communicate with us, and we could get that conversation going with them. But as always, we really appreciate anyone that logged in to listen to this. And our fourth session will be on Friday, July 21st, from 10 a.m. to noon. And if anyone has any information that they would like to see presented, or any discussions that they would like to see happen for that next session, we are currently taking ideas for that. So you could let us know in an email, or whenever we're meeting monthly with each county, you could also let us know of any information that you would like to see. And as always, here is my contact information for anyone that would like to contact us. So I really appreciate everyone for logging on, and then I really appreciate Gina, Chris, Kathy, really appreciate everything that you do and everything you did to kind of prepare for this session when it came to the peer discussion.
Our pleasure.
Thank you.
thank you.